Legionnaires' disease is a severe form of pneumonia caused by Legionella bacteria. The most common type of Legionella bacteria is Legionella pneumophila. The disease spreads through the inhalation of contaminated water or soil particles, often in the form of mist. It is not typically spread through person-to-person contact. The bacteria are naturally present in freshwater environments. They can contaminate various water systems, including hot tubs, cooling towers, and large air conditioning systems. Besides large water systems, other potential sources include freshwater ponds, fountains, respiratory care devices, potting mix, and compost. The bacteria thrive within amoebae, which are common in biofilms found in water systems. Older age, smoking history, chronic lung disease, and a weakened immune system increase the risk of infection. The time between exposure to the bacteria and symptom onset is usually 2 to 10 days, but can be as long as 20 days. The disease is more common in the summer and early fall. However, it can occur any time of the year. Legionella bacteria flourish in warm water, particularly between 25 and 45 degrees Celsius. Temperatures above 60 degrees Celsius can kill the bacteria. Outbreaks often make headlines, but many cases happen in isolation, not linked to a particular outbreak. The disease's name comes from an outbreak at a 1976 American Legion convention in Philadelphia. Legionnaires' disease is likely underreported because it is relatively rare and shares symptoms with other conditions. This can lead to misdiagnosis. Common symptoms include cough, shortness of breath, high fever, muscle pain, and headache. Other possible symptoms include nausea, vomiting, diarrhea, confusion, and impaired cognition. Legionnaires' disease cannot be diagnosed based on symptoms or chest X-rays alone. Confirmation requires specific tests to identify the bacteria. Diagnosis often involves detecting the bacteria in a patient's mucus, finding specific antigens in their urine, or comparing antibody levels in blood samples taken weeks apart. The urine antigen test is a fast and accurate method for detecting a specific serogroup of Legionella pneumophila. However, this test may not detect other less common serogroups and species of Legionella. Effective treatment involves antibiotics that can penetrate the infected cells. Macrolides, tetracyclines, ketolides, and quinolones are common choices. Early treatment with appropriate antibiotics is essential to improve outcomes and reduce mortality. The death rate for Legionnaires' disease can vary depending on factors like the patient's overall health and how quickly treatment begins. Modern treatments have significantly reduced the death rate. Preventing the disease relies heavily on properly maintaining water systems. Developing a comprehensive water safety plan is crucial to minimize the risk of Legionella growth. This plan should address water temperature control, prevention of stagnation, biofilm management, and disinfection protocols.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.